Doc, thank you so much for your time and welcome to the South African Morning. But it's quite concerning here to learn that it seems a growing pandemic fatigue, if I could put it that way. And people are just starting to sort of almost lose their consciousness when it comes to wearing masks.
Yes, absolutely. I think what we are seeing from the survey findings is this phenomenon of pandemic fatigue, where we're seeing not only declining usage of masks, but also people seeing that they are less fearful of the virus itself and also much less concerned about catching it. And of course, that level of decreased fear then means that people are not taking public health measures as seriously. So we are also seeing, as well as people saying not wearing masks every time that they go out, we're also seeing a greater number of people reporting having gone to large gatherings with more than 50 people. And again, obviously, the less compliant people are with public health measures, the greater the likelihood of transmission of the virus.
Now, it's interesting because you actually conducted a study here and findings advise that, there seems to be a behavioral change in opinion or perspective when it comes to COVID-19. Take me through what you found just in terms of, what adults think about the pandemic, about, COVID-19 as a virus during this time.
So a greater number of adults think the threat of the coronavirus has been exaggerated. We started this study in April, so we've been tracking attitudes and perceptions from April during the hard lockdown up until September, and the survey will be ongoing as well. So what we see is in the hard lockdown, only about 3 in 10 adults say that they think the threat of the coronavirus is exaggerated. But as we come now to September, we see that number growing and it's now 4 in 10. So that's quite significant in terms of, equating to a proportion of the population. So more than 10% from April believe that this threat of the coronavirus is exaggerated. And I say this then corresponds to people, not wearing masks in public. So this perception of that the risk being exaggerated really then corresponds to people's behaviours in terms of how they try to prevent themselves from catching coronavirus.
Yeah, and Doc, could this particular, data sort of advise on possibilities as to why we're also seeing increased numbers of positive cases, especially when you talk about contact tracing, because if people are being complacent in adhering to these health measures, then perhaps it's one for medical practitioners and even government to consider as to possibly why we're having these increased numbers.
Absolutely. I think what this survey shows really corresponds also to our daily experience, where we obviously see people are being less compliant with wearing masks. But what the survey does, obviously, is to demonstrate that this is an experience that is happening across the country. And it underscores the importance for continued and strong public health messaging, not just around wearing of masks, but also the importance of hand washing. We have to remind ourselves that those little squirts of sanitizer that we get when we walk into the shops, are not enough in and of themselves. Hand washing continues to be one of the best ways to protect ourselves from catching coronavirus. So we need those strong and continued messages. And again, from our survey, what we see is most people are getting their information from television. So that also gives government some direction on where they should target messaging.
Yeah, and just speaking of messaging, the reality is that South Africans are going through a pandemic fatigue. More and more South Africans just feel like, we're at level down, we can almost sort of relax. When you speak of messaging, do you also mean that maybe perhaps health practitioners and even government need to address ways for South Africans to deal with the fatigue, sort of skills and, coping mechanisms to sort of remind us that we should not relax, even though that fatigue is very much a reality?
I think that's definitely part of the solution, but I think what also is very important coming through the survey findings is the considerable economic distress and impact the pandemic has had on people. So the survey shows that 4 in 10 adults are going to bed hungry, and this is nearly double what it would be before the pandemic. So we've got the midterm budget obviously coming up this week. So things like the measures to extend the social relief of distress grant are absolutely critical in actually combating this pandemic fatigue, because in my analysis, I think when people are weighing up the real risk of hunger and that real feeling and the threat of catching something that you can't see and you can't touch, that, you know, is playing a real role here in people's pandemic fatigue. So we have to think about this as a coordinated response, thinking about not just the mental health impacts, but also the economic impacts, and trying to address those together as far as we can.
Well, Dr. Carin Runciman, thank you so much for talking to us on this issue.